Good afternoon. Today is Friday, the 24th of July, 2020, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA. So as usual, we have the English language version once a week and according to the situation. Usually we recap the spokesperson's briefing. In addition, we have customized certain information and content that is necessary for the English language audience to know every time we have this briefing as well. So first of all, just to thank all of you once again, Thai citizens and our foreign friends in Thailand and abroad, for your understanding about the various measures thus far, the situation, and most importantly, the cooperation in this matter to ensure the safety of our the continued safety of our families and our friends. As the spokesperson had mentioned and briefed today in one of the many charts today, globally, we've reached around 15 million cumulative cases worldwide already. Now that's of course an astonishing number for a pandemic, 15 million. But luckily for Thailand, in these rankings, we are around number 104. So being quite low in that rank is actually good news. The measures continue to be dynamic. We continue to, of course, assess the situation every day, every week, even though now we are in the stage of so-called normalcy, or the sixth stage. We don't use the word sixth phase that much, but we use normalcy. The spokesperson also highlighted about the quarantine system, wherein for us in Thailand, we continue to improve and expand the various types of quarantine systems. As you know, the SQ, ASQ, LQ, and the like, which are mentioned quite often. So one type is called the organizational quarantine, and discussions are underway with various organizations, and the spokesperson also invited various organizations that are interested in becoming an organizational quarantine to come and discuss with the CCSA to be approved to become an organizational quarantine. The standards, of course, would have to be the same as the state quarantine system, and these would include various organizations, perhaps like universities and schools and the likes and the like. So moving to the general situation and the number of cases that we have. So in total, for the cumulative number of cases in Thailand since the very beginning, many months ago, we now are at 3,279 cases cumulative, with 58 fatalities. Perhaps in the future we will not be mentioning the fatalities because it has been zero for many weeks and months already. And of this number, 3,107 cases have recovered and returned home, therefore making the number of cases in hospital and currently receiving treatment as 114. Since we have the English language version once a week, I'd just like to recap the numbers in the past 7 days. So during the 18th to the 24th of July today, for Thailand, we recorded 40 infections and 0 fatalities in the past 7 days. 40. For today, in particular, Friday, as you can see on the slide on screen now, we have 10 cases recorded today. As usual, all are imported cases, and currently the infected persons have been put directly into the state quarantine system. All imported cases of persons returning from countries Sudan, Pakistan, Germany, the Netherlands, and the United States via the repatriation flights. So as other countries and territories around the world are trying their best to deal with the rapid rise, the new high, the astounding numbers that we hear, the alarming numbers that we hear, the number of cases and new waves of infection in Thailand in terms of domestic infections. Today we have, it's the 60th day already. 60 days that Thailand has had no local infection. So 2 months with no domestic infection in Thailand. The spokesperson also mentioned about the case of Rayong, just to update. As you recall, we had talked about the case of Rayong in the past briefings. It is now 14 days already after the case was known in Rayong. So we had 12 persons who were at high risk, and they were monitored, and there had been no reports of infections. And actually, Rayong has already begun to plan activities in order to build confidence in the province and encouraging tourism to return back to the province of Rayong. Activities like sports and music activities, however, of course, with the various measures strictly in place. So that's good news to hear, just an update about Rayong. And the 10 cases that we had for today, all were tested positive during the quarantine. So that reflects, of course, the capacity of the quarantine system in Thailand, the surveillance, the screening, the prevention and control measures which were well executed. So these 10 cases all found in quarantine during their quarantine. And of course, that means that it has not been spread outside of the quarantine system. So thank you very much to all of those who understand and support and are cooperative with the quarantine system in Thailand, be it the SQ, ASQ, LQ, or other types of quarantine that will be put in place. One important piece of information in the past week is about the extension of the emergency decree. In spite of the stable number of the cases in Thailand, we still need to remain vigilant as the pandemic is evolving, it's dynamic, it's living, and affecting everybody around the world. And as mentioned, the number cumulative around the world, alarming, it's 15 million. 15 million, perhaps that's probably higher than the number of the population in some countries around the world. So it's still there. And with the accumulated total of 630,000 deaths around the world as well, coupled with the 15 million. So in this connection, with the situation that we are monitoring around the world, on the 22nd of July here in Thailand, here at the meeting of the CCSA, which was chaired by the Prime Minister, General Prayut Chan-o-cha, the CCSA General Meeting approved the extension of the emergency decree for another month to the 31st of August 2020, which will be forwarded to the Cabinet meeting for its endorsement early next week on the 29th of July for endorsement. This, of course, is to enforce the restrictions, the tracking and quarantine system and surveillance of suspected cases. It will also facilitate the relevant officials to be able to handle the situation efficiently. The enforcement will remain for a certain period of time until to ensure the readiness to move even forward beyond this stage of normalcy, because we should still remain on guard and take all necessary precautions. In summary, I think we should not rest on our laurels. We should remain vigilant, even though we're at a very good standing right now compared to other countries around the world. But the situation around the world, of course, is still worth monitoring, of course. And the emergency decree would not include the prohibition of assembly as with the previous version of the emergency decree. So that will be proposed to the Cabinet on the 29th of July. So for the seamless transition back to normalcy, that's an important step for the CCSA. The CCSA working on plans to boost the economy while ensuring the safety of all. So as you recall, earlier we categorized the various groups of persons requesting to come back to Thailand into 11 groups. Foreign nationals and Thais. For the foreign nationals in those groups, almost the numbering around the thousands, already almost 1,000 have begun to return to the country already, and many have already. Now, one update, a slight addition to the 11 groups, is that we have number 4 now, four new type of category. So the CCSA has approved in principle for this phase to allow 4 groups, a new categorization in addition, 4 groups of foreign nationals to enter the country. The first is foreign nationals participating in exhibitions or trade fairs in Thailand, trade fairs, exhibitions, conventions. The second is foreign nationals who are film crews with a specific itinerary for their visit. The third is under discussion, the migrant workers from our neighboring countries for the construction industry and the food industry as well. And the fourth is, of course, the medical tourists. And all of the foreign nationals mentioned would have to fulfill the various requirements. The various agencies are still working with the detailed guidelines for this new category of persons, and the effective date will be announced in due course. And for other groups, including business persons, specialists, Thailand elite card holders, and the diplomatic corps representatives and international organizations, of course, we are discussing with, as you see on screen now, a briefing for the heads of missions of the diplomatic corps and representatives of international organizations. This briefing was held by the Ministry of Foreign Affairs on the 17th of July last week. It was also reported in the local news as well as one good step in communicating with the diplomatic community here on the various updates, various guidelines. And of course, the set of more detailed guidelines for the groups all mentioned will be further announced. But of course, the diplomatic corps and the embassies here are at par and at pace with the measures announced by the CCSA, as you can see in this picture here, this visual picture here of the briefing. Also, one piece of information the spokesperson highlighted was on a special panel discussion, which actually will be televised today at 1 p.m. On this channel, and that will be posted in the NBT2HD's Facebook page tonight as well. So there was a special panel discussion on the 22nd of July as well, with prominent figures in various areas, as you can see on the slide, on the picture on screen. That included Dean of the Faculty of Medicine and the various persons involved with the economic and as well as health measures in Thailand to share their comments and visions and views. So one important piece of information that I'd like to add is on the extension of stay for the various visa types in Thailand. As you would have known already, on Tuesday, the government spokesperson confirmed about the extension of visas for those staying in the kingdom to be extended to the 26th of September 2020. However, the difference is this is not an automatic extension of stay like the past 2 times. It is actually a grace period from the 1st of August to the 26th of September for foreign nationals stranded in Thailand to apply for a further specific period of stay, which would be granted according to the regulations if qualified. So not exactly an automatic extension, but a grace period until it's almost 2 months of grace period. That's a good number of days. 2 months of grace period for that time to apply for extension or to depart from the country. The scheme, however, will come into effect as soon as it is published by the Royal Gazette. So therefore, we urge foreign nationals to discuss in contact with the Immigration Bureau as soon as possible to prepare for your next steps. The applicants have to specify their reasons for staying on in Thailand to ask for that extension during the grace period, whether the reasoning being no flights or due to the lockdown measures in their own countries, making them not able to return, and submit proof of the various documents on a case-by-case basis. So the hotline, of course, of the Immigration Bureau is 1178 for more information. For Thais and foreigners exempted groups coming in the country who are already coming in already or on their way or in under process of application for the 11 groups or the 4 groups in the future, as I mentioned. And planning to travel to Thailand, the first point of contact, of course, is to contact the Royal Thai embassies and Royal Thai consulates in your country, in the country that you are residing in. Or there is another channel, which is the hotline number of the Department of Consular Affairs of the Ministry of Foreign Affairs. The hotline number is 02-572-8442. I mentioned this because there were some inquiries on this. Also through Facebook pages, also you can receive information on that of the Ministry of Foreign Affairs on information regarding your inquiries, your travel back to Thailand. Now on screen is just a new application, just for your information, Thai consular application for Thai nationals who are abroad to download and make use of the information as another convenient channel to get information from the Department of Consular Affairs for nationals abroad. So just for some additional points, the fight against COVID, of course, continues to require concerted effort, and all of us play an important role in protecting the physical health as well as the mental health of ourselves and others during these difficult times. And of course, with any crisis, nothing is perfect in any crisis. The pandemic globally has provoked a series of discriminatory acts across the world with groups of people such as those tested positive for COVID, those who have recovered, those who have been released from quarantine or traveled back from abroad. They have experienced stigma along with the healthcare providers and frontline workers. Many have experienced stigma during the COVID pandemic. So unknowingly, this can lead to more fear, more anger towards ordinary people, between different groups of people, instead of joining hands in fighting against the real cause of the problem. So stigma can even make people want to hide and not reveal the symptoms or the illnesses that they have, and keep them from seeking proper health care, making it more difficult to control the spread of the disease. Now, I mention this because it is relevant for every country around the world, and for the English language audience to know that here in Thailand at the CCSA, we are trying to address the problem, these kinds of problems, and we recognize the needs and the problems of different groups of people. So just some suggestions to make Thai society a beautiful society, and get rid of stigmatization or discrimination or even xenophobia as a result of the COVID situation. First, maintaining privacy and confidentiality of those seeking health care, that should be supported. Second is informing others when there is a risk from contact with products, people, and places. Third is correcting the negative language by sharing the accurate language, the accurate information, the correct information, and spreading positive energy to others, especially to healthcare workers and those working in the front lines. Your support is very important and very necessary. The spokesperson also showed some images of the World Health Organization in process of preparing a documentary on Thailand and New Zealand as a model country in terms of the experiences and lessons learned, and that is still under production. It's in cooperation with the Ministry of Public Health of Thailand. The WHO has also explained that there are 3 main risk factors, and we have, I believe, a infographic here coming up. Yes, avoiding the 3 C's, the 3 main risk factors that people should avoid in order to stay safe. So as you can see on screen, avoiding crowded places, avoiding close contact settings, and avoiding confined and enclosed spaces, which will lead to higher risks. So therefore, I'd like to recommend to all of us to avoid, to follow these guidelines. This is an infographic you can find on the Facebook page of the Public Relations Department. and continue to follow the good hygiene and keep our own families and loved ones remaining in the safety zone. So for the English language summary, as I mentioned, once a week and according to the situation as needed. In the meanwhile, the spokesperson mentioned that you can find all sorts of useful information on social media, the official Facebook accounts, for example, of the various government agencies, the CCSA, the Ministry of Foreign Affairs, the Public Relations Department, the Communicable Disease Department of the Ministry of Public Health as well. So, hoping that you stay safe, have a very pleasant weekend. I believe it's a long weekend ahead, and then we'll see you again next week. More power to you all. Thank you. สวัสดีครับ
ครับขอบพระคุณนะครับท่าน